So I'm a classroom teacher, I guess by trade. I've left the classroom. I'm a foster adoptive mama, so a lot of trauma trainings. Hold on, let me tell my nephews to be quiet a minute. No. Um, and so we have a lot of alphabet soup behind my daughter's name. She's 7.5, but at age 4 is when the ADHD, anxiety, insomnia diagnoses came through. And then they said processing disorder, but nobody pursued that. And I kept saying, are we talking sensory? Are we talking auditory? What are we talking? Because I could see symptoms of both. So anyway, fast forward to finally this January when she was old enough for the normed auditory processing disorder test. She was diagnosed with auditory processing disorder in, I believe, 2 different areas, but I failed to remember which two. So Facebook, Google, all this stuff. I found Dr. Ray, I believe, early February, mid-February, and we started talking about the low gain hearing aids after our audiologist had said to go like the Phonak FM receivers. And I just loved how Dr. Ray was working with me, and it wasn't pressured at all. She's like, go see if your insurance will cover it and stuff like that. And anyway, I was like, I don't want to wait, like, let's just move forward. And I could immediately see, like, we put them in my daughter's ears for the first time, which took some sensory for her, right? Because the hearing aids and getting them in, it took several days to get them in far enough. But all of a sudden she was like, I can hear. And she has normal hearing. She's passed every hearing test no matter what, even though for years I'm like, are you so deaf? Are you and not trying to like mock that, but like that's how it was. Like you could talk to her and there'd be no reaction. And I'm like, how are you passing your hearing tests? Because there's no anyway, she put those hearing aids in and like seconds later, she's like, I can hear. Like it was just mind-boggling how quickly they helped. And over the next few weeks, this was just, this winter, stop. Um, we worked with Dr. Ray, fine-tuned a few things, and I could see emotionally she started to get more regulated. Um, she does have trauma because I didn't get her until age 2. Sit. Let him go. Um, and we've got a few other things that we think are going on besides the diagnoses that she does have. I love that Dr. Ray has said, let's look into cued speech. And I showed them, both my daughters, this a little bit and sign language, and they're thrilled and they want to use it to communicate. So, and actually, as I was listening to Carol Ann and the SSP, I've heard about it. I've looked into it a little bit. And with my trauma training and stuff, as with anything I work on with my daughters, when you're working with sensory integration, primitive reflex integration, and all these things in regulating, you get dysregulated and have to re-regulate and reteach, the brain and the neural pathways and all of that. So getting dysregulated during SSP or primitive reflex training and all these exercises that we're doing, we have to back off sometimes when I do that with her, just because it does become overload and too much. So I am trying to work with Dr. Ray and some other parents that are interested to really bring cued speech as a maybe normative therapy or something, or like I really am trying to re-envision school because traditional school is not the best for my oldest daughter. Um, so with my teaching background and a few other things, I'm really trying to envision what would be best to incorporate a world in a school day of, cued speech, equine therapy, trauma training, and all those things. So I know that was a lot of convoluted information, but really these low gain hearing aids have blown my mind with how well my daughter, and there's days I can tell if she's dysregulated. I look at her and I'm like, do you have your hearing aids in? And there's been several times she's like, no. And I'm like, go get them in.